Hello, I'm Dan Taussig. We created this video to help you learn more about hepatitis and share news about new managing procedure and possible treatment and cure. Hepatitis is the inflammation or scarring of the liver, the organ our body uses to flush out harmful toxins. In the past, to detect liver damage required an intrusive, painful procedure and complicated medication. The good news is that today, we can easily manage and treat hepatitis. What causes hepatitis? It can be a number of factors: certain drugs, other diseases, heavy alcohol use, or bacterial and viral infections. If not treated, the liver may worsen and a condition known as cirrhosis can develop. Cirrhosis is a stiffening of the liver. When this happens, the liver cannot function and it may fail. Hepatitis A, B, and C viruses are similar in a number of ways. All can be transmitted through blood-to-blood contact, which can occur by sharing needles, including tattooing and piercings. They can also be transmitted through sexual intercourse with an infected person or through mother-to-child transmission during birth. These hepatitis viruses are not transmitted through casual contact like hugging, sneezing, or shaking hands. Symptoms for hepatitis A, B, and C are also similar: fever, fatigue, or feeling very tired, loss of appetite, nausea, vomiting, abdominal and joint pain. Your urine may become dark or your stool may be clay-colored. You may have jaundice, which is a yellowing of the whites of the eyes. If you have one or more of these symptoms and you think you may have come in contact with someone that has hepatitis, you should notify your medical provider. Though the viruses have similarities, each presents specific risks and challenges. Hepatitis A is a commonly contagious infection. It is the only one of the three that can be transmitted through the stool of an infected person. In most cases, this can happen when someone doesn't wash his or her hands before preparing food. While hepatitis A is the most contagious of the three, it is the only virus which will clear on its own after a few weeks. After running a series of blood tests, your provider can let you know if you are or have been infected. Hepatitis B is common worldwide. It affects many people, but in the United States, it disproportionately affects Asian Americans and Pacific Islanders. Though they are only 5% of the population, they make up over 50% of those infected in the United States with hepatitis B, and in fact, the virus is a leading cause of cancer deaths among Asian Americans. A preventative vaccination is recommended against hepatitis B, but for those infected, there is currently no cure. The good news is that a treatment with oral medications can suppress symptoms and lead to a better quality of life. Ask your medical provider if you should be screened for hepatitis B. Hepatitis C is the most common blood-borne viral infection in the United States, infecting more than 3 million people. It is the leading cause of death in patients with HIV. The majority of people living with hepatitis C, diagnosed and undiagnosed, are those between the ages of 50 and 70, known as the baby boomers. If you were born between 1945 and 1965, you are part of this population and may have been exposed to hepatitis C. According to the Centers for Disease Control and Prevention, many in this age group could have been infected from contaminated blood or blood products before 1992. This was before widespread screening of the blood supply began with mandatory universal precautions. Hepatitis C is the only one of the viruses that now has medication with a 99% cure rate. The Centers for Disease Control and Prevention recommends that people between the ages of 50 and 70 be screened. Those with hepatitis must be managed to detect liver damage. Until recently, a painful and invasive liver biopsy was the principal method of testing. Now in most cases, hepatitis B and C can be managed more routinely using a new painless technology called the FibroScan. The FibroScan is a machine much like an ultrasound that takes a scan of the liver. It's painless, there's no prep time, and it usually takes 10 minutes. The CORE Center was the first to use the FibroScan in place of liver biopsy in Illinois. We currently lead in the number of FibroScans performed among medical institutions in the state. There is no long waiting period for a FibroScan appointment. Keeping the liver healthy is important for everyone, but it is really important if you have a hepatitis virus. Increasing your water intake, eliminating alcohol and drug use, and getting the appropriate vaccinations can help your liver continue to function properly, even with hepatitis. If you have questions about anything you've seen in this video, ask your medical provider today. Thank you for watching.